Dr. Cameron, today we're going to talk a little bit about children. And I know it's questions that you get asked all the time by parents. So what's an appropriate age to start bringing children in to see the dentist?
So usually what I tell parents, if this is their first child, I say once they have a tooth, bring them in with you when you come in for your visit. We'll take a look, more for the parent's instruction than anything, to talk about, start talking about what's normal, how should you help take care of them, and all of that. And then when they actually start getting their teeth cleaned, it's usually around 3 years old. That can vary depending on the child, but that's usually kind of the average of what we shoot for.
Okay, so we're starting around 3. That's actually a really good idea, because have they, if they've come in for all those years before, they're not going to have that usual fear of the dentist that a lot of children have.
Absolutely, and that's what those early appointments are all about. Even when they've come in for their first cleaning when they're 3, we may use the same type of toothbrush you're using at home to clean their teeth, but we're going to do it, very thoroughly as we will, and get them comfortable. We'd much rather they have some positive experiences, right? Definitely. Before they need something that may hurt or it may bother them. Then all the noises and smells are weird, right? Yeah. And it looks like a bunch of nurses and doctors that they're used to when they go to the pediatrician and get shots. Right? So we're trying to
possibly running around with masks on, and it can be scary. So
exactly. Really I wear funny glasses, and so everything just looks weird, and it scares kids. I mean, it scares adults, right?
Oh yeah.
So for a kid, where everything's huge, it's good to ease them into it. Yeah.
Okay, so 3 years of age, we're going to start looking at cleanings, and what follows on after that?
So after that is their regular recare, like we want for anyone, of twice a year coming in. We're going to get X-rays usually about once a year. That depends on someone's risk for cavities. We're going to make sure their teeth are all in and coming in like they should. By 3, they should have all of their baby teeth. And then we can also watch when a kid falls and there's been trauma. Parents always worry. We can assess that with them and keep an eye on things.
Is there something they can do that you can do? I've seen a lot of little kids heading to the dentist. They've knocked a tooth either completely out or they're loose. You can fix those things, can't you?
Yeah, when they're little and it's their baby teeth, if a tooth gets knocked out, we usually don't put that back in, because we can actually damage the permanent tooth growing under it when we do that. But we'll usually look at it and just kind of make sure, did the gums get cut up? Is their lip? We're going to make sure everything's okay, and then advise on what to do next. If we're talking an older kid with a permanent tooth that pops out, there's definitely a lot that can be done to get that back in and keep it.
Right. Okay, so we're moving on in time now, and maybe our teeth are coming in a little crooked. When do we start looking at braces?
So usually if you talk to your pediatric dentist and your orthodontist, we're all saying around age 6 would be the best time to just assess and see what they look like. We can know based on how their baby teeth are, the size of their jaw, of what are we kind of looking at, what's the timing, because not everyone starts when all their permanent teeth are in. Some a little earlier intervention is advisable to set us up to succeed, and others it's just parents concerned about something. We want to address that and at least have a plan. Everyone prefers to have a plan from someone that knows what they're talking about, rather than just, oh well, I think
maybe we should do this, or perhaps that.
And also at about that age we can take one of the X-rays that goes around the whole head to see, are all the permanent teeth going to come in, or are they missing some? It's fairly common for someone to be missing a permanent tooth.
Is it?
And that may change our plan of how we attack things, even what we do with the baby tooth. If we know there's not a permanent one growing in behind it, we may treat that tooth a little differently, because now that's going to try to be a permanent tooth. We got to take good care of that and watch it.
So it sounds to me like prevention is the best policy here. That's why you want to start seeing them younger.
Yeah, I mean, prevention in general, like anything, whether it's your home, your car, your mouth, prevention's a better experience. It costs you less in time and agony and money. So we'd rather see them and get them off on a good foot, because it's easier for everybody, us included, right?
Yeah, definitely. You don't want a screaming child in the chair.
No, because if they're terrified, that weighs on everyone. It weighs on the parents. It weighs on us. No one likes to be in that situation. So if we can prevent it, 100%, that's what we want to do.
Okay. What can we do specifically for children's teeth these days? I know sometimes there's fluoride available in the schools. What can you do specifically to help the children's teeth?
So one of the best things we can do is obviously the professional cleaning, making sure we know where are their risk areas. Everyone's mouth is a little different. Some build up bacteria and tartar in certain areas. others don't, some a lot earlier than others. So we can give a lot of just very personalized, individualized advice on how to take care of this child's mouth. And also we can notice they may be brushing for what they think is 2 minutes, right? And if they're like my kids, they're sitting in the same spot, they sucked off the toothpaste right at the beginning, right? And then they're just sitting there and they're saying, yeah, am I done? Am I done yet? Right? And then I'm a dentist, I'm a tooth nerd, so I look in their mouth and I think, well, what were you doing for 2 minutes? Right? So
they were humoring dad is what they were doing.
Exactly. And we all know it's no secret, adults don't floss as much as we should. Kids even less. They don't have the dexterity to do it very well. So us helping them see how to make that easier, giving tips to the parents, kind of coaching, and also, as anyone with kids knows, it's much easier if someone else tells your child about something they need to do, because if it comes from mom or dad, I see it all the time where the mom or dad's just exasperated, like, I tell them, brush your teeth, I tell them every day. But as a parent, you're telling your kids a lot of things every day. And so
it kind of switches off.
Give a little backup. You know, we may scrape something off their teeth and show them just to gross them out. And say, this has been sitting on your tooth. No, sometimes they don't care. They think, oh, that's cool. You know, but we can coach them through some of that.
So it sounds like if you have a child or children that you want to start introducing to the whole dental experience, come on in and see Dr. Cameron here at Aspen Dental. Thanks, Dr. Cameron.
Thank you.